Men who exercise regularly are less likely to have problems with erectile dysfunction than men who don't exercise.
As a general practitioner, Dr. David Bowering saw men engaging in behavior contributing to shorter lifespans. He was instrumental in the creation of a men's health report, which led to a grassroots movement to assist men in living healthier lives. A team from Northern Health traveled to 7 communities in northern BC, sitting down and talking to men to get more input on what could be done to tackle their health issues. This led to a second report, titled Men's Health Matters Because Men Matter. It was issued in the fall of 2011. Also during this time, a young man by the name of Brandon Grant was hired. With a background in health science, Brandon's skill set and personal attributes were exactly what Northern Health was looking for in order to put their plan in motion.
Not just sitting in an office and coming up with different practical solutions for men's health from a desk, is I actually get to go out and talk to people. So my first day on the job, I got to travel for the first time to northwestern BC and talk to folks all across communities like Terrace and Prince Rupert and Houston, and talk about, what does men's health look for you in your community. So when speaking to folks, they gave us real great ideas, practical solutions that are going to work for them in their communities.
Grant's father had just been diagnosed with prostate cancer for the second time. He took the job, hoping to prevent others, like his father, from facing illness.
How do we talk to men and come up with practical solutions that men understand, that men can apply to their everyday lives? Because we're all really, really busy. We've got busy work life, we've got a family life, and how do we come up with practical solutions to really get men more healthy in northern BC? We have respect for each other. During
Grant's first few weeks on the job, the men he spoke with gave him some straight answers, many of which have shaped what the Men's Health Initiative is today.
They said we need to partner with industry. That was very important because the guys, they've got the safety end of health and safety at work, but they don't have that health end as well. So partner with industry, come up with humorous and practical health promotion campaigns.
Are you man enough to play dress up with your daughter?
You look like the princess.
We developed things like our men's health website, the BC Men's Health Challenge. We came up with the manual because guys said that it's funny that we take care of our vehicles and our quads and make sure they get all the maintenance checks and oil changes, but we don't do that for our own body.
Grant and his team are now visible through the Northern Health region, from Prince George to Fort Nelson, McBride to Haida Gwaii. They offer men the chance to get screened for a variety of conditions, not in a doctor's office, but at sports tournaments, car shows, mining expositions, places where men feel a little more comfortable. These screenings typically include a check of blood pressure, blood sugars, and cholesterol.
Okay, so it's just going to be a little prick.
I think what guys like about it is we know that traditionally guys don't like sitting in a waiting room or going to a clinic. Guys really need that flexibility in terms of how we provide health services. So the fact that we can bring some elements of those services to events where they already are has created a little bit more ease. It's quick to go through a screening process. You're able to get referred directly to your doctor for follow-up. Guys like that. It's very practical and hands-on, and the fact that you can get through and get good health information at a timely event where it's a hockey game during an intermission. Guys like that.
Well, my wife particularly has been one of the biggest facilitators of us getting physically active.
Medical Health Officer Dr. Ronald Chapman supports the idea of taking the simple tests to more accessible places for men.
We need to go where the men are, to create awareness. And that just makes a strategy that makes sense. If you can go to places where men frequent, and let's use that opportunity to promote the health. I think that's the ideal scenario.
Well, definitely, we know that there's good evidence around things like blood pressure screening, being able to sort of save lives, and diabetes screening being able to save lives. Will we be able to affect the sort of overall culture around men being risk-taking, because there's other issues around men being brought up differently and being more inclined to take risks? I think it's a long road.
It can save your life. There's something down the road maybe that will come up.
During a mining conference in 2012, Dean Price took part in a men's health screening sponsored by Northern Health. Blood work showed he had high cholesterol, and now he's working hard to change his numbers through diet and exercise.
I thought I was fairly healthy, but apparently my age level's getting to that time in my life where I got to start looking after myself a little bit better, start eating more healthy, and it's something that I naturally don't do. I would like to come home and just eat junk food all the time. I got a sweet tooth, but you know, it will catch up to you.
Lauren, did you need water?
Dean and his partner Lauren Phillips own a safety training company. Through her work with Dean and her work in the safety field, Lauren sees a lot of risky behavior, especially from young men.
I see a lot of guys that are trying to work hard and do good things, but they're not looking after themselves in the meantime. So not getting enough exercise and eating, smoking and drinking, and the biggest thing I often notice, especially with young men, is risky behavior in terms of taking undue risks when recreationally or with work, not realizing that they need to wear the right equipment and that things can happen to them.
And at home, Lauren is doing her best to help Dean stay on track with diet and exercise by doing the same herself.
Dean's a pretty busy guy, and he works long hours and long days and is in and out of town, so it's helpful when I can help him by helping him eat right and encourage him to get out to exercise all the stuff he wants to do but has a hard time doing otherwise.
Though Dean is a physical guy all day at work, Lauren says he sometimes needs a push in the right direction to go for a walk, run, or even a snowshoe, just for fun. It's part of the role women play in keeping their partners healthy.
I think we need to look after ourselves and then also help them look after themselves. So identify if they've got any issues. If they do, send them off to the doctor right away if it's some problem, or at least get checked out and be sure. Get regular checkups and all that good stuff, because why wouldn't they? They can't look after us, and they can't look after themselves if they're not being proactive. So encouraging them to look at the big picture and stop and take the time. It might take an hour, but it's a quick phone call and make an appointment, and it doesn't have to be that big a deal.
Dean's health is always top of mind for Lauren.
Anytime you've got a partner and somebody that you live your life with and you rely on to be a big part of your life, you want to make sure that they're happy and healthy now and in the long term. So whether it's, you know, he doesn't have great posture all the time, and is he going to be a hunched over old man, or is it, you know, is he been getting enough exercise, how's his stress levels? Those are things that affect both of us. So I want to make sure he's doing well.
Coming up, the Men's Health Initiative and what's down the road.
Prostate cancer is higher in men than breast cancer is in women.